Okay, this video is called Demented Female Patient, Middle Age. And this is sort of just a typical patient that I see. And I'm sharing this with you so you get a sense of how these patients become demented. Okay, this is a 61-year-old lady. Whenever the patient's in the ballpark of my age, I'll just call them my age. I'm 61 years old. I have zero medical problems. I don't take any medications at all. That's what you want, all right? This lady has progressively worsening dementia. She's trying to cope and compensate for it by doing things like, you know, her family thinks she can't drive anymore. She's trying to drive, but she keeps getting lost. She uses a GPS to go to a nearby place that she's been to 1,000 times because she can't remember anything. She can't live independently. The family takes care of her. She's forgetting more and more stuff, and she's basically becoming demented. She's not severely demented, but she's got lost too many times trying to take the car somewhere that she's not going to be allowed to drive anymore. She's hypertensive, so they got her on a beta blocker. That beta blocker might also be for rate control. She's got atrial fibrillation. Remember we talked about the Jack Delatory theory of dementia, meaning that if you can't get enough blood to your brain, chronic underperfusion of the brain, to get blood somewhere is called perfusion. The purpose of a blood pressure is to get blood to the top of your brain, cerebral cortex, pumping it against gravity. So if you drop that blood pressure by putting the patient on something like a beta blocker, which lowers cardiac rate and cardiac pumping power, you're also diminishing the blood supply to the brain. That can cause dementia. Okay. Now, if you don't treat the high blood pressure and it's really high constantly, the high pressure hitting against those arteries with high pressure, that will damage the arteries, cause atherosclerosis, decrease oxygen to the brain. So that will cause dementia. So you're kind of damned if you do, damned if you don't with hypertension. The only real way to win the game is eat the right diet and keep your blood pressure at a reasonably normal level. That's how you win the game. That's what Kempner did. That's what Pritikin did with treating his patients, and McDougall. That's what smart people do. But most people are not smart when it comes to health. Okay, what else? She's had rheumatoid arthritis for decades, so she's on prednisone, very powerful corticosteroid. What do corticosteroids do? It's like the stress response. They raise blood pressure, so now you're chasing your tail with your hypertensive medicine, okay? So it's going to raise blood pressure, it's going to add volume to your circulatory system, it's going to raise your blood glucose level, hyperglycemia. That hyperglycemia, that's like diabetes, right? So it worsens potential diabetes. And chronic hyperglycemia can damage the eyes, diabetic retinopathy, can damage the kidneys, diabetic nephropathy, the peripheral nerves, diabetic neuropathy, small vessels, diabetic microvasculopathy, all that stuff, it's all bad. She's also on methotrexate, a real powerful immunosuppressant, putting her at risk for infections. Methotrexate itself can cause significant cognitive impairment. She's been depressed off and on, so she's on a tricyclic antidepressant for that, sort of an old school antidepressant treatment. Nowadays they usually use SSRIs or variations thereof, SNRIs or something. So anyways, those all, like look at the greatest psychiatrists who ever lived, Bregan, they cause cognitive decline. They all cause a slowly progressive dementia, okay? Lobotomy, all psych drugs cause brain damage, all right? There's no easy way around that. They don't really know what they're doing. All that stuff about the neurotransmitter theory, that's all nonsense, okay? She's got migraine headaches. She's on sumatriptan, but she's also on divalproex, which is also an anti-seizure medicine. What does an anti-seizure medicine do? Seizure is the brain overspeeded up. So seizure medicines, anti-seizure medicines, they slow the brain down. Well, if you slow the brain down, what do you think that does to your thinking ability? It makes you stupid. It lowers your IQ. So that's the trade-off with anti-epilepsy drugs. They slow the brain down. Okay, she's got atrial fibrillation. Atrial fibrillation means you're losing about 25% of your cardiac output, potentially. So that's going to get less blood to your brain. Supply and demand theory. Metabolic demand stays high, but oxygen glucose delivery is low because you're not pumping enough blood to your brain. You start losing brain cells. It's a Peter Rogers, MD, supply and demand theory of cognitive decline. And it kind of goes hand in hand, Jack Delatory. But so mine actually is sort of like the all-encompassing theory that includes all the nutritional things and the pharmacologic stimulants and stuff. So Delatory's is basically hyperperfusion. So you could say Delatory's is a subset of my theory, really, because I go into a lot more stuff. All the mitochondria inhibitors. She has a tendency, I don't know her entire diet, but I know she eats lots of processed food, and she likes to microwave her processed food. And, she shouldn't be standing next to the microwave or she's going to get EMF'd by that. The processed food tends to have tons of preservatives in it. The preservatives typically are, mold inhibitors, fungal inhibitors. Those are typically intermitochondrial membrane mitochondria inhibitors, okay? Electron transport inhibitors. She's also eating processed food, which means there's going to be a lot of MFG and MSG. MFG is manufactured free glutamate, monosodium glutamate, especially MFG. Well, that's a stimulant, so that's going to raise the metabolic rate. So everything that raises the metabolic rate, it increases the amount of oxygen glucose delivery that has to be increased in order to compensate for it. So you put yourself at increased risk for dementia. Who knows if there's aspartame in there? I don't know if she's on any additional meds for AFib. I didn't catch that in our conversation. Hypothyroid, levothyroxine, your replacement for thyroid. So what I'm trying to say is, I first of all, when I see a demented patient, I look for all the pertinent negatives. Does she have low B12? No. Is she an alcoholic? No. Tobacco smoker? No. Marijuana smoker? No. Substance abuse, IV drug abuser, and then she could have HIV or something that'll cause dementia. She doesn't have any of that stuff. She don't have hepatitis. She's not a drug addict. She has not had a hysterectomy. I've seen lots of people get females demented from a hysterectomy before age 35. Usually it's for fibroids. Usually it's because they eat a high-fat, high-meat diet. They drink tap water with all the estrogenic chemicals in it. They also expose themselves to personal care products with all the estrogenics in it. Let's see what else. And then they eat a low-fiber diet, so they can't excrete it from the body adequately. Okay, what else? I don't know what her folate level was. She's not alcoholic. They're not worried about thiamine. We do a brain MRI to look for rare reversible causes, like a big brain tumor, benign brain tumor, meningioma. I almost never see that. I see it about once every 15 years. We'll also look for, large ventricles out of proportion to sulci dilatation, things like communicating hydrocephalus, MPH, but I almost never see that. Yeah, I see it sometimes, but hardly ever, and hardly ever do I see it and they go to get shunted and they get better. That's a rare event. Yeah, it happens, but it's a zebra, it's a unicorn almost. Okay, when you hear hoofbeats, you think horses, okay? And horses are diabetes, hypertension, polypharmacy. This lady has polypharmacy. She's on all these pills plus several other ones. Proton pump inhibitors for the belly. That also contributes to dementia. And the reason I'm showing you this is to help you get it. Do you get it? These people who go down the path of man's way of health, of pill after pill after pill, match the ill to the pill and send a bill, they do crappy. They don't do well. They're fat, sick, and stupid typically by 60 years of age. She's more demented than the average 60-year-old, but most of the 60-year-olds by 60 are pretty mentally slow. Most of them can still find their way home. Can't find her way home without a GPS, and even the GPS isn't working for her anymore. So what I'm trying to say is, don't let yourself end up like this. They're screwed, okay? Because it gets worse. I hadn't even gone into it yet. She eats a high-fat diet. That's going to cause blood sludge, decrease oxygen delivery to the tissues. She puts sodium on her food. That's going to vasoconstrict her, less blood flow to the brain, okay? She's probably eating non-organic food, so she's going to have the GP, glyphosate, sprayed on the soy. That's a protein source for processed foods. That's an excitotoxin. Stimulant activates NMDA receptor, substitutes for glycine. It's thought on the NMDA receptor. That's going to make things worse. Atrazine is going to be sprayed on the corn to make the high fructose corn syrup sweetener and cornstarch and other things like that. That's also toxic to the inner mitochondrial membrane, and it's estrogenic. Okay, it's all routinely contaminated, the high fructose corn syrup sweetener, with mercury. That's also inhibits the mitochondrial matrix. The preservatives and all that processed food, typically mold inhibitors, antifungals, that inhibits the inner mitochondrial membrane. So she's got a whole bunch of things inhibiting her inner mitochondrial membrane. And these are only the meds that I know she's on, because I don't always catch all of them, in conversation. It goes by me pretty fast, or when I look at the chart, I sort of remember what I thought was interesting key points. But I'm letting you know, this is routine stuff. I see this all day long, all the time, and these patients do crappy. I never hear about them turning around. Once in a blue moon will I hear about a patient turning around with communicating hydrocephalus gets a shunt. I hear about that about once a year. Okay, that's how rare that is. And these patients, I don't ever hear about them turning around, never, okay? And I'm also telling you, based on what I know of being a doctor over 30 years, the only way to win this game, low-fat, low-sodium vegan with no oil, avoid processed foods, that's it. Otherwise, you've got so many things working against you, it's not even funny. There's not one or two or three or four, it's more like 10 or 15 or 20 things working against this brain, and it doesn't look like it's going to make it.